I'd like to begin with the basic movements of the instrument. How to make it work for you and to make your work easier. Let's begin with the tiller bar. When you bring this tiller bar up, you have total control of the caudal section of the instrument. When you use this, this will be up and down. There's also a foot pedal here that will lower or raise the instrument for you. Above that on the tiller bar is the automated tension, the power balance of the caudal section, so that when you set the tension on the caudal section, as I'll show you, this instrument should move at just a touch of your finger, regardless whether the patient weighs 500 pounds or 75 pounds. You will set the instrument so that it does all of the work at bringing the patient back to detente. And all that you and I have to do is control the contact and the proper force applied to the segment of the spine we are treating. And we'll be covering that in great detail. The tension here, if I increase the tension, you'll see that the tiller bar will bring the table up into greater tension. If I drop it, it will lower the tension. So whatever the size of the patient, and incidentally in a day of practice, you'll hardly ever have to touch that, because it's not that much difference between the average patients that we treat having to set the tension. But if you get a really big person, that's when you really appreciate the tiller bar tension setting. This is the knob. It's made to ergonomically accommodate the doctor hand. So that during treatment, it takes pressure off of the wrist. And you know, as you and I age, and you know I'm a little older now, it means that you have to learn to work smarter, not harder. So we built ergonomics into the instrument. When you contact here, there's the least pressure on your own carpal tunnel. Your median nerve doesn't suffer. Neither does the ulnar nerve and the Guyan canal. So little things like that we've thought about in creating the instrument for you and for me to use in daily practice. Just behind this tiller bar is a button that you can contact with your middle finger to apply long Y-axis decompression. As we go through today, you'll see how easily this is to use. Incidentally, the instrument will move into caudal distraction up to almost 14 inches, so that no matter how tall the patient is, you and I can accommodate. When we begin to look at the movements of the instrument, allow me to show you the locks. On the lower end of the caudal section is the flexion extension lock here. When you release that, we can apply flexion and extension of the human spine. It's just that easy with fingertip control with proper power balance of the caudal section. This lever, lateral flexion. Again, just that easy to be done with fingertip pressure. Then when we apply lateral flexion, we can also apply lateral flexion and flexion in a movement called circumduction. Here I'm applying with the long Y-axis, using the instrument with lateral flexion to circumduct. You can also bring the patient into long Y-axis, lock it under decompression, and apply lateral flexion or circumduction under long Y-axis decompression, especially useful for any condition introduced spinal stenosis to the spine you were treating, because we want to increase the disc space, increase foraminal area, drop intradiscal pressures before we place faucets into the other physiological ranges of motion. You totally will run the instrument from this caudal section. When you apply long Y-axis, you can do it from the tiller bar here, or as you notice, you can do it by an electrical switch here. When you press this electric switch, note that the instrument will move into long Y-axis, and you'll see how we use that in clinical practice. Two safety features which are vital to you and to me as clinicians and treaters of human beings. One of them is the safety features that if anyone were to crawl underneath this instrument. Here's a safety feature which I think is absolutely essential on these instruments. You'll note that if we are bringing the table up, and if someone were underneath it and the table is moving downward, there's a pressure strip here that not only when it's contacted will it stop, it will raise the table so that if someone gets under that, it will stop, come up to release the pressure. Another feature that I'd like to share with you is that while we are using unattended long y-axis distraction, we said it, we're using unattended long y-axis distraction, and while the patient is under that, if they should feel any discomfort at all, there's a stop, a kill switch under the right armrest, a little red button that they just press, and it will stop the instrument. Okay? And we tell the patient about that whenever we start them on unattended long y-axis distraction. When you do use that, you will have to stop long y-axis here, turn the power off, turn it on again, and then you can use the unattended long y-axis again. When you want to stop unattended long y-axis, all you do is press the automated button. It will move back to neutral, to detente, and stop. Okay? So those are the basic uses of the caudal section of the instrument. We will also be talking about thoracic drops for treating sacroiliac joints. So there are thoracic drops, and I'll show you the use of them as we proceed. One last thing. On the ankle bracket, in order to apply distraction, we can use the tiller bar. All you have to do is press this lever, it releases it to decrease or increase the depth of caudal distraction. On this tiller bar is a button that says automated. Okay. On the side here is a computer that we can set the depth of distraction, that is how far this caudal section will move, anywhere from 1/2 to 2.5 inches at half-inch increments. So I typically will set this at 2 inches. Right there, it's set for 2 inches, and this is the timer. I typically will set it for the 12.5 minutes. With it set at the time and the depth of distraction, we will then have it set at automated and press the start button, and the instrument will now apply unattended long y-axis decompression, thoracic and lumbar restraint. If you want to isolate the decompression force to a specific level of the spine, you can use the thoracic restraint. Merely bring it over the patient, attach it to the opposite side, and by placing this at any given segment, given level, we can isolate the distraction force to that segment or that individual level of segments that we want. Let me share with you what this headpiece can do for you in your clinical practice. First of all, long y-axis distraction is the primary feature of this instrument. This is long y-axis. Now you will note it moves very, very smoothly. You'll never see anything like this on another instrument. Well, you'll never see it on another instrument. But that's how smooth that cervical headpiece applies long y-axis distraction. As I share the technique with you, you'll see that this is probably at least 60% of the treatment of both Protocol 1 and Protocol 2 patients. That is, those who have radicular upper extremity pain and findings, and those who do not have pain extending below the elbow. So this lock controls long y-axis distraction. You can stop it at one of 5 detente points to apply a given set of decompressions. This movement is the lateral flexion. and you can combine in a coupled movement, long y-axis and lateral flexion. This movement is flexion and extension on the headpiece. This one locks the long y-axis. This locks flexion and extension. Okay. On the front of the instrument is the lock for rotation. And note that when you use rotation, it doesn't require any effort on our part to rotate. The instrument moves with no resistance to our palpatory skill. Okay? And you'll see as we treat, we combine all of these movements in Protocol 2. So these are the movements of the headpiece. The tiller bar will recede out of the way and move back up to any given height that you want. You will see that we use occipital restraints, and these go over the patient's occiput to allow us to apply long y-axis distraction for Protocol 1 and Protocol 2 with full range of motion using the occipital restraints. And then you'll also see that we adjust the thoracic spine with the occipital restraints in place. And vis-a-vis that when we place these straps, they're on the bottom of the headpiece is a piece of Velcro that will attach to. And here, wherever these two cross, will be the place on the patient's spine that you are applying long y-axis distraction. Lastly, realize that people have different facies. You will want to set the opening of the headpiece to match the zygoma and the frontal bones for the patient and the nasium. And you do that here. Patients will learn to run this. They will set it to the comfort size of the headpiece that fits their particular need. When we're ready to place the patient on the instrument, we place the face paper in place, and there's a holder in the bottom that holds paper in place. When the patient lies down, we want their eyes right here. There's a 4-inch cutout of soft material so the patient can leave contacts in and it will not aggravate them. So with the patient, we ask them, lie on your stomach with your eyes right here. And so why do we want the eyes right there? Well, because it places a C5, C6 disc space right here at the caudal end of the cervical headpiece. It's in the proper place for the fulcrum movement when we use long y-axis or physiological range of motion to each segment of the cervical spine. It also gives them comfort for the eye. It gives us the best placement for decompression long y-axis movement of the neck.